When a woman becomes pregnant after 35, she's considered to be of advanced maternal age. But what does that exactly mean? What are some complications pregnant women face as they get older? And what medical options are available to test and treat women of advanced maternal age to ensure the healthiest pregnancy possible? I'm Dr. Sean Donishman, perinatologist with the San Diego Perinatal Center and founder of Miracle Babies. This is Preggy Pals episode 60.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way. Welcome to Preggy Pals, broadcasting from the Birth Education Center of San Diego. Preggy Pals is your weekly online on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Sunny Galt. Would you like to access all of our archived episodes, bonus content after each new show, and great giveaways and discounts? Then you need to join our Preggy Pals Club. You've heard about it before. We're going to tell you about it all the time. And you can also get a free subscription to Pregnancy Magazine when you do that. So visit our website, preggypals.com, for more information. And another way for you to stay connected is by downloading our free Preggy Pals app. It's available in the Android and iTunes marketplace, and by subscribing to our monthly newsletter. So we have a packed house today in the studio, and I always love it when that happens because the conversation is always so good. So we're going to go around and introduce ourselves. Also mention as part of your introduction if you are of advanced maternal age and when that lovely transition happened for you. So let's start things off with Annie. Go ahead.
My name is Annie. I am 35. I turned advanced maternal age last Tuesday.
Congratulations.
Thank
Welcome
you.
to the club.
I know. Yes, thank you. I'm a government contractor is my day job, and then usually it ends up being a night job, a labor doula.
Okay.
But going to be taking a little break from that for baby number 3 here.
Okay.
Baby is coming in October. Not sure baby's gender.
You're Team Green.
I'm Team Green.
Yeah.
I am. Yeah. This is my 3rd child. I have 2 older daughters, and I'm planning home birth.
Yay. Okay, Christy.
I'm Christy. I am a very young 41. Thank you very much. And I'm due on Labor Day. Another baby has a sense of humor. And it's a girl. It's my first. And we're going to have a birth center birth.
Okay, Abby, go ahead.
Hi, my name is Abby. I also turned 35 while pregnant. That was last month. And I'm a social worker. Due October 3rd with a girl. It's my 2nd girl. I have another girl that'll be 2. And planning a birth in the hospital.
Okay, and joining us via Skype from Germany is Amy. Amy's been on the show before, but she recently moved to Germany, and we're so happy to still have you as part of Preggy Pals.
Yay, I'm happy to be here. Thanks for having me. I am Amy, and I am a blogger and writer and a work-at-home mommy. I have 2 children when I was advanced maternal age. I was 35 with number 2, and I just have a 4-month-old, and I was 39 when I had her. Both of them were born all 3 of our kids were born in a birth center. And yeah, all natural birthing.
Wonderful. And you guys know me, but I do have some news to share with you. This is the first time I'm announcing it on Preggy Pals. I am pregnant. You guys knew that, which is exciting. This is our 3rd pregnancy, and we have 2 little boys already. But the big news is last week. Was it last week? Gosh,
Yeah,
the time. Was it last week? Okay. Yeah, you guys are all friends with me on Facebook, so you know. We had some big news. We actually went in for our first trimester screening. I went by myself. My husband was at home with our little boys, thought this was a routine screening just to make sure there's nothing wrong with the baby. And the sonographer takes one look at me and she's like, "Oh, twins." And I thought she was joking. I really did. For like a good couple minutes, I was looking around the room for the cameras trying to figure out, okay, what show am I on? And, why are they
serious,
picking?
Sunny? I didn't know this.
You didn't know this? You've been moving and stuff, Amy, so, you know.
I'm out of the loop here in Luxembourg. Yeah.
Yes. Yeah. So this is big news for us.
Oh, yeah.
But we are having identical twins.
How exciting.
Yeah, I know. We don't know the gender yet. Hopefully we'll find out soon. Very happy news. I've actually always wanted twins my whole life. No twins in the family. Doesn't really matter with identical, but that was the only way we were going to get twins, is if my egg split in 2 randomly, and that's exactly what happened. So anyways, that's my big news. So we will be right back. All right, so before we kick off today's show, we are going to do a pregnancy app review. It's something new that we're doing here on Preggy Pals because we all love our smartphones and our tablets, and we're obsessed with technology and counting contractions and all that fun stuff. So we're going to review some of the apps that we've found that we really like. Today, we are focused on an app called Sprout. We're focusing on Sprout Pregnancy because I think they have a Sprout Baby version too. So after you have your baby, you can move on to that app. But this is called Sprout Pregnancy. And there's a free version. And when you first download it, it actually allows you, I think for 15 days, it automatically upgrades you to their premium version. And then after the 15 days are over, it downgrades you. It's pretty neat. You can enter in your baby's information, obviously your due date or the date of your last period, and it'll kind of configure all that for you. I was a little bummed, not that I expect all these app people to cater to me and my pregnancy, but this is just for singletons. They don't have anything for twins. And I was like, it might be kind of cool to be able to compare and contrast. But no, some of the things I like the best, I think one of the initial screens that you go to actually has a really cool image of a baby in utero. And it says at the top, you can put in your baby's name, but it automatically tells you what week you are. So if someone's like, hey, you're pregnant, how many weeks are you? Like, I don't know if you guys have a hard time figuring this out.
I always forget. I have to look at the apps.
You have to look at the app.
Yeah,
right?
like what Thursday is it? Yeah.
Right.
Yeah, Thursday too. I know. I know it changes on Thursday.
Yes.
Yes, exactly. Right. But it's
Change
hard.
every Friday.
It's hard to remember all that, right? So it tells you the week at the top, and then you could click on these little areas to learn more about what the baby is doing. So, and there's some other cool features on it too. In the tools section, they have some cool stuff. You can track your weight if that's important to you. A kick counter, which I never did. My doctors wanted me to do kick counters, and I never did. Contraction timer. I'm in a little bit different group because I'm a C-section girl, but I did use it with my first pregnancy. Was a vaginal birth. So those are some of the things I really liked, but I wanted to talk to you ladies who have had a chance to test this out and see what you guys thought. So Abby, I know you had a chance to look at it. What do you think?
Yeah, I really poked around and tried out the different areas, and I also have something to compare it to because I use two different apps.
Okay.
I used them during my first pregnancy and again this time, so I have something to compare it to. Overall, I feel like it's a little bit more comprehensive than the other two apps with all the things that it offers. For example, like you're saying, among the tools, the kick counter and the contraction timer, I actually had to get those as separate apps because they weren't in the pregnancy apps I was using before.
Okay.
So I did use the kick count, like a kind of kick counter, and I found it was really helpful. I didn't end up using the contraction timer because my water broke. I just went in. And then one other thing I liked under the tools in the Sprout application is the organizer. Mm-hmm. There's like a doctor visit planner.
Yeah, I like that too.
And I was like, well, I just keep my own notes, but they have question ideas, which was really good. So like, here's an idea of questions I should ask during trimester 2.
Yeah.
And so I liked it. And there was kind of like a little packing list. Oh, I have one quibble on the packing list. Mm-hmm. They said knows like things that you need. And newborn essentials, they had formula.
Yeah.
So that might be one little piece of feedback to give them is that an absolute essential you don't need to buy is formula. Because if I didn't know, it was my first pregnancy, I think like, I'm supposed to have some.
Yeah. Well, and one thing that I thought they could do too is allow those to be edited. Like you can add to it, but I don't think you can delete. Christy, what do you think?
I actually have been doing kick counting, and I have a little piece of paper that my childbirth class gave us to do, and I never write it down. And quite frankly, I try and do it when I'm starting to go to sleep at night and trying to watch the clock, and then I fall asleep. Where if I have the app, I really like that part of the app, that it'll just start counting and I just hit the kick. So that, I think it's actually, to me, it would be worthwhile to upgrade this to I think it's $3.99.
Yeah,
just for the kick counter.
Yeah. Mm-hmm. Okay, so for the ladies that were able to kind of check this app out, the Sprout app, thumbs up, thumbs down. Would you recommend it to another pregnant mommy?
Yeah.
Yeah?
Yeah, thumbs
I
up.
think I would too. Okay, we're going to give this a Preggy Pals thumbs up. Well, you thought 40 was considered over the hill, but when it comes to pregnancy, they have actually lowered the bar to 35. It's called advanced maternal age. And here to tell us all about it is Dr. Sean Donishman, perinatologist with the San Diego Perinatal Center and founder of Miracle Babies, an organization providing information and financial support to newborns in the NICU. So, Dr. D, welcome back to Preggy Pals.
Thank you so much, Sunny. Thanks for having me.
Yeah, last time we had you here, you were talking about high-risk pregnancies.
Right.
Yeah.
Right.
So I feel like this kind of is lumped into that category a little bit, or at least can be. So let's define what advanced maternal age is. What does that mean?
So advanced maternal age is a term that's actually being phased out because in the past, we used to offer genetic screening and testing to women 35 and older because they had a higher threshold for having babies with chromosome abnormalities.
Okay.
And since now these tests are offered to every pregnant woman, we're really phasing out the term advanced maternal age. However, 35 and older women have an increased risk with their pregnancies, mainly chromosome abnormalities, and I can tell you more about that. Should I?
Yeah, let's go ahead. Let's talk about that.
So patients that turn really 32 and above, their chance of getting pregnant, meaning the time fecundability, which is the probability of getting pregnant within one menstrual cycle, is decreased. So it takes longer for women to get pregnant. 35 and above, when they get pregnant, they have a higher chance of having miscarriages, unfortunately. When they do get pregnant, they have a higher risk of having ectopic pregnancies. Also, multiple gestations is higher with women 35 and older. Once they are pregnant, obviously chromosome abnormalities. Obviously, every pregnant woman who's especially 35 and older, because I see a lot of patients that are in that age category, they're concerned about chromosomes, they're concerned about congenital abnormalities, and there's some data in the literature suggesting maybe there's a higher risk of heart defects. I don't want to scare people on this panel, And obviously, I tell all my patients, older women, 35 and older, they're all young, but they do fantastic. But there are some concerns and some precautions that we need to take. So again, up until the age, about 20 weeks of pregnancy, everyone's concerned, oh my God, how's my baby? How are the chromosomes? And we'll talk about, obviously, the genetic screening and testings that are available. And then after that, gestational diabetes mellitus is higher, hypertensive-related crises are higher, and also it's intuitive. The older you are, the more likely you may have some comorbidities, such as being overweight or have hypertension or diabetes. So number of visits to the hospital may be a little bit higher. Your cesarean section rates may be a little bit higher.
Yeah. Well, ladies, how do you feel about this term in general, about advanced maternal age? I didn't, for some reason, and I kind of said this in the intro, but I thought that was 40 and over. And I don't know if that's just a societal thing that, again, you're over the hill when you're 40 or whatever. And Christy, you're not over the hill. That's not what I'm saying,
no, I don't feel it, no.
But, our society says, okay, once you reach 40, your life is half over, which is ridiculous. But we're trained to think that. So I guess, has advanced maternal age, Dr. D, has that always been 35?
Yes.
It has always
Yes.
been.
Yes.
Okay, so ladies, how do you feel about this?
I think back at my mother, and she tells the story of when my youngest brother was born, and this was back, early 80s, I guess, and that was, there wasn't the plush, hospital accommodations. All the pregnant women were kind of together in one room as they labored. And then when it was time for you to have the baby, you went into the delivery room. So the nurses, intaking her and asking her what her age was, and she said 33, and said she was like dead silence in the room, like it's the old lady over there. But I mean, I think nowadays, like you were saying, doctor,
absolutely,
women are starting their career later.
Yeah.
They're putting off having their family. So I think it's more common for women to start their family in their mid-30s or even their early 40s before they start thinking about that. I mean, when she, had me, that was even her having me at the age of 26, I think it was. That was like, oh, so you're waited a little bit to have a family, and nowadays you ask anybody in their mid-20s, and I'm like, well, I'm still having fun. I'm still, so it's different, I think, and of just how we're growing our families now.
Yeah.
It's true. And it's important, Annie, that, if whether you're 35, 36, or 41, I think it's just important on how you live your life. So, lifestyle measures, how are you eating, are you exercising, not using tobacco? I mean, just what do we do to stay healthy and decrease inflammation? Mm-hmm. That's the key. But there are obviously some independent risk factors when you turn older. I mean, you have no control over what your eggs are doing. So you have a higher tendency to have trisomies, so 3 chromosomes, such as 21 or 16. Those things you have no control over. But we certainly have some control over our environmental risk factors?
I think on the whole, I'm healthier now than I was in my 20s. And so I'm definitely exercise more. I didn't really exercise in my 20s, eat better. So on the whole, I feel better. And I'd also like to point out my doctor doesn't call me advanced maternal age. Their official term is elderly.
Yeah,
It's
me
in
too.
the computer is elderly.
It's awful. It's
Yes.
awful.
Yes.
Yeah, I know.
That's me.
Yeah.
What the heck is up with that?
Right. It's in the literature. Yeah.
Yeah.
It's
Elderly
unfortunate.
multigravida means it's not your first. If you have elderly primigravida, is that?
Right.
Is that your first? And then after that, the elderly just would get to me every time.
That's
Yeah.
my
In my
official
mind, I'm still 22.
diagnosis
Mine
on
too.
everything is elderly multigravida. It's like, okay,
It's
thank
awful.
you.
That is absolutely awful. I know.
Yeah.
Hideous.
Yeah.
It's embarrassing.
Thank you for saying that. Yeah.
And
That's so true.
in my personal experience, I haven't had any issues. I'm knock on wood. I've been very, very fortunate. I was pleasantly surprised with both pregnancies to get pregnant in the first month.
Nice.
And so far, I have to say it's been kind of smooth sailing. So I just kind of have to laugh a lot. I'm elderly. So what is that going to mean? Are they going to treat me different?
Yeah.
Am I going to have to do more tests? And so
Yeah.
it definitely raises questions.
I had the exact same experience. So I've been very lucky. And, I was listening to Dr. D talk about how you have more difficulty getting pregnant or any of these things. I mean, my midwives were always telling me, oh my gosh, you're how old? So they would see the elderly multigravida on my chart and they would say, oh my gosh, I thought you were like 25. And I said, well, in my mind, I am. I know. That's what I keep telling everybody. I don't know what this elderly stuff is all about. Yeah, I was very healthy and I've been very blessed and agreed with everybody. I think that if you're healthy in your habits, when you're trying to get pregnant, it seems to go a little bit better. I've had 3 beautiful pregnancies and beautiful births. And I think I'm just healthier in general in my 30s and approaching my 40s.
And it's important. I agree, Amy. I think it's important also, when patients come in, I had a patient who's 45 years old come in spontaneous pregnancy. It's important just to inform patients on what's out there in the literature, but really this is not real science. So there is some data suggesting that you have a higher risk of having placenta previa. There is a higher risk of having a growth-restricted baby. There is a higher risk of having preeclampsia or gestational diabetes. What measures can we take to make sure that you do well?
Right.
And
But when you say high risk, I mean, it's still in the minority. It's of the
Right, so,
percentage,
of
the
course.
percentage of the likelihood of me having a baby with Down syndrome at 41 is still very small.
Yeah, how much does it go up? When we say we've got an increased risk, I mean, you mentioned age 32. So between 31 and 32 or 34 to 35, are we talking about a huge increase? I mean, how is that number picked out?
With
I
with
guess?
the age of 35, it's about 1 in 360 chance of having a baby with Down syndrome, and at the age of 40, it goes up to about 1 in 45. So significantly higher, but still the odds are that your baby's going to be normal. For example, when we say preeclampsia is higher, the incidence of preeclampsia in the average patient and the average patient population is about 3 to 4%, and someone who's 40 and above is about 7 to 8%. So I tell my patients, your risk is higher. It doesn't mean you're going to have it. So get a blood pressure monitor starting at 20 weeks and start checking your blood pressure on a daily basis. And these are the parameters that I want you to look at. If it's above this, make sure you call me. So early intervention, just knowledge, I think, is power. Just knowing what things to look for and not necessarily it's going to happen to you. And this is, oh my God, you're 41. Oh my God, you're doomed. No, you're going to have a healthy, beautiful pregnancy. Before your pregnancy, most important, just control the environmental factors, which is eat very well, take your folic acid, and now the folic acid that everyone's talking about is methylated folate, so methylfolate. Make sure you're not smoking, you're not drinking, and eating very healthy.
Another thing that I think that is missing in the medical model is the aspect that even though we might, as elderly, mature mothers to be
Experienced.
Well, I'm not even experienced yet. This is my first. But that as an older woman in this, I don't even like saying that, but I've had a lot of living. I've done so much, and I don't feel like I'm putting anything on hold or I'm missing out on any life. And so from a spiritual, mental, emotional standpoint, I think I'm treating my body and my baby so much better than I would have in my 20s because I'm ready for this. So there's the balance where there's the medical part that, yes, of course, there are higher risks, but there's the balance of what that means. And I'm even just creating a more sane serene environment in my body for the baby to grow in.
Kristen, darling, I really agree with you. I think because the most crucial time in a child's development, brain, I mean, the most important organ in our body is our brain. And the most crucial time in addressing a child's brain is 0 to 5. So it's from now until the age of 5. So I agree. When I see an 18-year-old come into my office who's pregnant, I spend a lot more time talking about what you do after delivery. So when I see someone, who's in their 30s or 40s coming in, I know that these people are obviously a lot more experienced and they know what it means to take care of a child. So those discussions are not held as much. So I agree with you, because really that stage, 0 to 5, is so crucial. How you nurture this child, how do you create a very nurturing environment for this child's brain to develop, because 90% of who we are is really established at that time. And then your neocortex, your thinking brains, obviously continues to grow.
Okay, so we actually have a question from one of our listeners on Facebook. And Stephanie, why don't you tell us what our listener is saying?
Okay, our question is from Nikki Helms. She says, what are the hidden risks of getting pregnant after 40? And she says, I know about Downs and such, but what other dangers are there?
Okay, so Nikki, there's independent risk factors for preeclampsia, which is a condition where blood pressures go up. There's increased risk associated with developing gestational diabetes. Those are the really main two concerns. Also, cesarean section rates are higher with women 40 and over. I'm sorry, I'm going to say these.
Not me.
I know.
Except Christy.
Not my reality.
I know. Also, stillbirths are higher. When you look at the overall increased risk associated with stillbirths, it's about 3 to 4 per thousand in a younger woman, and women who are at 40 and above, it goes up to about 8.5 to 9 per thousand. So again, not huge, but the numbers go up. So therefore, more testing is involved. So I tell my patients they get screened earlier for diabetes. They also get screened again at 24 to 28 weeks for gestational diabetes mellitus. Like I said before in the show, I ask them to get a blood pressure monitor and start checking their blood pressures 20 weeks onward every day. And I tell them if your blood pressures are over 140, over 90, either of those, please contact your provider. Every month we get an ultrasound, because there's also increased risk associated with growth restrictions. So every month patients get an ultrasound. Again, this is all done just to we want to identify if there is a problem earlier than not. And then starting at 34 weeks, we recommend undergoing non-stress tests, which is basically recording the baby's heart rate for longer than the 15 seconds or 10 seconds that physicians listen or midwives listen to the baby's heartbeat, and that's done for 20 minutes. And then also looking at the amniotic fluid volume, and that's done starting around 34 weeks, twice a week until delivery.
I have to chime in. The non-stress test was something I keep telling you guys, I'm so hands-off. That was the most wonderful experience of my entire pregnancy because I would sit in a chair and read a book and no one could interrupt me, and it was lovely. So I highly recommend the non-stress test for we mature mothers.
Yeah, the non-stresses have a very good negative predictive value. So we're looking for, if there's any evidence of hypoxia with our babies or lack of oxygenation. And I have to tell you something. This is not a HIPAA violation because I'm not naming any names, but if it wasn't for the non-stress test just recently, 2 weeks ago, I would have lost a baby.
Wow, really?
In all honesty, something just very rare happened with this patient where one of the arteries, one of the vessels in the baby's heart was closing, and that baby could have passed away within a matter of days.
Wow.
It's just,
that's amazing.
It was a very rare thing to happen. So obviously we don't do it for that, but
yeah, we caught it.
Yeah.
But the likelihood of a woman over 40 having an absolutely normal pregnancy is more likely than her having a problem.
Absolutely.
I think that's a great point.
And we have to always focus on that. And I always tell that to patients. These are things that we talk about, we're concerned about, but at the same time, your odds are you're going to have a very healthy pregnancy.
Okay, so we talked about this really quickly earlier, at least we kind of teased it, and there are different tests that are associated with advanced maternal age, things that may be recommended, and we're going to talk about that. We're going to take a quick break. When we come back, we'll talk more about those tests, so we'll be right back. All right, welcome back. Today we are learning all about advanced maternal age, which is the term they give you once you become pregnant after age 35. And our expert is Dr. Sean Donishman, perinatologist with the San Diego Perinatal Center and founder of Miracle Baby. So before we dive back into this conversation, one thing that I should let all of our listeners know is something new we're doing here on Preggy Pals is we want you guys to be part of our conversation. So like our Facebook page, we're going to be posting updates on our Facebook page, as well as follow us on Twitter. So it's just Preggy_Pals is our name, or you could go to our website, just click on the Twitter link. And basically, we're going to have little Twitter parties. So every time we record a show, our fabulous producer, Stephanie, over here is going to be tweeting out some of the topics we're talking about, asking you guys questions. You guys can participate in our conversation and ask Dr. D questions, for example, in this episode about advanced maternal age. And that's one way you can get involved with our show. All you have to do, if you are following us on Twitter, look for the hashtag PreggyPalsVP, which stands for virtual panelist. Okay, let's dive back into this. So, Dr. D, let's talk about the first trimester screening test and what is involved. Now, this isn't something that's just for advanced maternal age. This is an optional test that any woman can partake in. Is it recommended more for women of advanced maternal age to determine if there's chromosomal? Did I say that right?
Chromosomal, yeah.
Abnormalities.
No, you're fabulous, honey. I think it's recommended for patients that, when I see patients in the first trimester, I ask them, there's obviously screening tests that are available. They have 5% false positive results with these. And what would you do with the information? So if a patient says, I want to have all the information possible, then we go through the steps. So first trimester screening involves two parts, which is one is a blood test. And the other one is an ultrasound, so which combines those data, and basically give you odds risk on Down syndrome and trisomy 18. So remember, you guys or listeners out there, that inside this beautiful sac where the baby resides, how does the fluid get in there? It comes through fetal urination and baby's lung secretions. Baby spits inside. And how does it get out? It gets out through three ways. It gets through the membrane called the intramembranous pathway. Baby swallows it and goes through the placenta. So 1% of these hormones go through the placenta and get into maternal blood. So in the first trimester, between 11 to about 13 weeks and 6 days, we do a blood draw for PAP-A, which is pregnancy-associated plasma protein A, and HCG. And then we look behind our baby's neck between the skin and the soft tissue, and we measure that distance. We take baby's size, mom's age, that blood work, and that gives us some odds risk. Okay, your risk for Down syndrome is 1 in 500 or 1 in 1,000. Then between 15 to 20 weeks, there's another blood test called the quad screening test, and that involves a blood draw, doesn't include an ultrasound, a blood draw, which screens for alpha-fetoprotein, human chorionic gonadotropin, inhibin, and estriol. And these test results can combine with your first trimester result and give you the final risk assessment. So someone will say, my risk was 1 in 1,000 for having a baby with Down syndrome. Let's say the risk comes back positive. My risk was 1 in 15, for example. Oh my God, does my baby have Down syndrome? Also, mom gets an ultrasound anywhere between 18 to 20 weeks. Sometimes moms may decide to get an ultrasound a little bit earlier. And then we look for soft markers. Is there anything on this ultrasound? First, how does the baby look from head to toe? Then are there any signs that this angel may have an increased risk for having Down syndrome? And then we try to combine those results with our risk assessments. For example, is there a bright spot in the heart? Is there fluid within the kidneys? Does anything look abnormal inside the baby's brain, such as a chorioplexus cyst, that increases the risk for trisomy 18? And then we try to combine those results with the blood tests and inform women. So first trimester screening, second trimester screening, and now there's something which in the past year and a half we've been offering patients, which is the blood draw for fetal DNA. There's fetal DNA in maternal blood that screens for the most common abnormalities, which are the trisomies and sex chromosome abnormalities. So Down syndrome, trisomy 18, trisomy 13. And I'm sure everyone knows what these are. There are 3 chromosomes instead of 2 chromosomes. Instead of two number 21s, we have 3 for Down syndrome, 3 for number 18, and 3 for number 13. And that test result is wonderful for patients who screen positive, who are at high risk, and it's got an excellent sensitivity and specificity. Now, if a patient comes in and, God forbid, has, for example, with a heart defect, which unfortunately affects 34,000 babies here in the U.S. annually, then, since there are other chromosomes abnormalities associated with that, then we offer an amniocentesis. Or if a patient comes in and says, I had a baby with trisomy 21 with Down syndrome with my previous pregnancy, what can I do? They can go ahead and do these screening tests, or they can just proceed with a CVS, which is chorionic villus sampling, which is in the first trimester, usually past 10 weeks. And that is a catheter that goes through the cervix or transabdominally, so through the abdomen, and gets some placental tissue, and we check for fetal DNA.
And that has to be done at a specific time, right?
Yes. That's done usually around 12 weeks, so 12 to 13 weeks. And then between 15 to 20 weeks, or between 15 to really 22 weeks, you can do an amniocentesis.
Okay. Now, can you talk a little bit about, now both of those are considered invasive procedures, right? So what is the risk of something happening to the baby? And with that risk, I mean, what could happen?
Yeah.
You know what I mean?
So the biggest obviously risk factor is pregnancy loss, and with twins, Sunny, it's higher. It's about 2.5% with an amnio. There may be a high risk with CVS, and there may be a need for an amnio with a CVS. But with an amniocentesis, the risk is about 1 in 500 to lose a pregnancy. So 1 in 500 women that have an amniocentesis may lose that pregnancy, and with CVS is probably 1 in 300. More amnios are done now than CVS, especially because of these screening tests and diagnostic tests that are coming out. And again, a CVS is in the first trimester, a catheter that goes through the cervix and takes basically placental tissue done under ultrasound guidance. So there's a sonographer who's standing there and scanning, your baby, and you can see this catheter actually going in and taking this placental tissue. And with an amniocentesis, again, it's an ultrasound guided needle that goes. It's a very thin needle, but it's a long needle that goes through the sac and draws that fluid. And basically within a week and a half, we can have results. We can have results on the most common chromosome abnormalities by doing something called FISH, and that you can get results within a matter of 3 days, 2 to 3 days, on the most common ones, so Down syndrome, trisomy 18, trisomy 13. Remember that most of these screening tests really are designed for Down syndrome. I mean, they're made to identify babies with Down syndrome because we're not very good at diagnosing babies with Down syndrome on ultrasound. 50% of the time, they look normal. So if we take 100 moms with babies with Down syndrome, we'll miss 50 of those babies. We'll say, oh, baby looks normal. So this is really, these tests are intended for patients that may say, I will not continue with the pregnancy, or I really want to know the information.
Okay. And obviously all these procedures are elective, right? I mean, nothing.
Absolutely.
Okay.
Yeah.
Anything you do with your pregnancy is elective. No one can force you to take any of these.
Absolutely.
I just share just with my personal experience. I have more, I guess, traditional medical care. I have an OB. I go through, a big medical provider. And immediately when they learned that I was 35, they assigned me to a genetic counselor, which that was my first introduction to advanced maternal age. I'm like, what do you mean? This is different. This is not like my other pregnancies. And I went in, and I was really hesitant about this appointment just because I don't think I wanted to be classified as advanced maternal age. I think I was having a personal issue with this. But it was really interesting because she was very knowledgeable, and she was giving me all the information about the risks, about the procedures, and really, sharing more information about the percentages, like you were talking about earlier, Dr. D, as far as, well, when you're 35, it goes up by this percentage, and I found it really interesting, and it got pretty in-depth. I think the appointment was about an hour and a half, and I learned a lot. And one of the things that I learned about, and I wanted to get your feedback on this, Dr. D, is the non-invasive prenatal tests where they're just drawing blood. And these are done through third-party companies. What can you tell us about that? Because I thought that was really interesting. I get really scared about invasive procedures. It all really depends on what you're going to do with the information, and everybody has their reasons for doing it. But for me, it's a very scary thing. So this is more of a blood draw, and it can gather similar information that an amnio or the CVS would gather, right?
Absolutely. So it's a blood test that looks for basically fetal DNA in maternal blood, and it screens for the most common abnormalities. Again, Down syndrome, trisomy 13, trisomy 18, and sex chromosome abnormalities. And there are right now 3 competing companies that are doing this. Yes, I think it offers certainly a lot of information for patients that are high risk. So a woman comes in and says, remember with twins, 33 is considered advanced maternal age. Sorry, Sunny.
Oh, gosh.
So I know. So
no one told me that yet.
No. So I've got a lot of patients who come in and say, you know what, I really want to avoid doing a CVS or an amniocentesis. What else do you have to offer? It's excellent also for really just information. And it can be done after 10 weeks, and it can be done anytime during the pregnancy.
I had it done.
Yeah.
You did?
I did, because when we went for the ultrasound where they tried to see the back of the baby's neck to test for Down syndrome, our little one is so active that they couldn't catch the back of her neck. So they didn't have that reading, so we decided to just go ahead. And the upside of it is that they also do the
gender?
The gender, so we
Yeah.
were able to find out the gender early on as well.
So at what point, how many weeks were you, do you remember, when you did it?
14 weeks?
Right.
About that.
And and the results come back pretty quickly, right?
Yeah, usually with a 2-week period.
Well, it didn't feel very quick.
Yeah.
Well, in the grand scheme of things, but I know you want that information, especially when you think something could be wrong. You want that information right away.
And Sunny, I want to talk about what you said about as far as, meeting with a genetic counselor. I always tell patients, this is information. Forget about all the terminology, elderly, advanced maternal age. This is for information. The more informed you are, the better it is. So go in there and listen to these guys. They're not pushing, it's your decision ultimately. But there is, every few months, other new screening tests are available. And it's just for information. Do you want to be screened for cystic fibrosis? Do you want to be screened for spinal muscular atrophy? Do you want to be screened for Fragile X? So I think the term genetic counseling is just, it scares people.
Scary,
it's scary.
It is.
But it's information, and the genetic counselors are wonderful. Go there and just listen to them, and you'll decide with your partner what you want to do.
Yeah. Can I ask about that? When I first went in, I said, well, I'm going to be turning 35, and they didn't offer the genetic counseling. And then I had my birthday last month, and they said, do you want to go in and see a genetic counselor? And I said, well, I'm second trimester. What would they do? So I didn't go.
Yeah, I think
is there still a point, or is it kind of after the fact now?
I mean, I think you can still, meet with them, but, certainly once you're past a certain stage, especially with chromosomes, you can still, can you do an amniocentesis at 26 weeks? Yes, you can, but there are obviously other risks associated with it, such as rupturing your membranes. Could you do a maternity 21 or a harmony test? Yes, you can, so you can get more information that way as well. But it's at the time of delivery, what's your age? That's when you're considered advanced maternal age or not.
Oh, well, that's really good information.
Yeah, that was information that was new to me because I always think when I got pregnant was the factor. And so we were talking earlier about the increased incidence of Down syndrome, and the genetic counselors show you the chart and everything. And so I was 38 turning 39 within a month of my due date. And so they said, no, we have to look at 39, not 38. And I said, well, that kind of stinks. I was like, but I got pregnant then, and doesn't that mean something? No. That's when you have the baby. And I said, well, maybe I'll have the baby early then.
and Sunny, you and I were talking about this, I think, the last taping of, I think that was kind of the offensive term. I mean, was number one, the elderly thing, which we've covered very extensively this morning. But also the fact that I had a baby at the age of 34 just last year.
Yeah.
So,
exactly.
So I'm like, wait a second. So, here I am, under midwifery care because I was very low risk.
Yeah.
Had a very healthy baby. She's about to turn 1, and here I am pregnant again. I got pregnant when I was 34. So I had a baby at 34, got pregnant at 34, but now I'm having this baby at 35. And now all of a sudden, what switched,
Your eggs went bad. I don't know what to tell you.
Exactly, yeah.
Your eggs suddenly went bad.
Mm-hmm, yeah.
It doesn't sound like Dr. D does this, but it seems like everyone who was ever a caregiver of mine during those 2 pregnancies definitely made a big deal about it. Every sonographer, every nurse, every midwife, everybody. And that, I don't know, I don't want to say offended me, but it was as such a healthy person who's never had anything wrong and is a very active, healthy mother, I just don't understand the hang up. But
whatever. A friend of mine was maybe 39, and her point of view was that she liked it because she liked getting the extra information and the extra ultrasounds. So
yeah.
I think that's a good perspective to have, really. Because like Dr. D said, it's additional information. Forget about the definitions.
Yeah, and I think, everything is, you have to individualize it to, every person. Like, for example, Annie had a healthy pregnancy at 34, and odds are she's going to do exactly the same thing this time. So, and that's what I tell patients. I think, we need to treat people as human beings, and we have to be respectful. So some of the terms I agree are absolutely
elderly, really? Can we
yeah.
petition to change that?
Yeah, can we? Is there something? Wait, Preggy Pal's going to start a petition. That's what we're going to do. Dr. D, you tell me where to send this petition. It'll be an online one. I'll get moms around the world to sign this, I guarantee.
Yeah. I love it.
Yeah. All right, Dr. D, thanks for joining us today. For more information about our expert as well as our panelists today, visit the episode page on our website. And this conversation continues for members of our Preggy Pals Club after the show. We are talking about the advanced maternal age ultrasound. What is it, and is it really needed? To join our club, visit our website, preggypals.com. Here's a comment from one of our listeners, and this comes from Debbie Hansen. And Debbie writes on our Facebook page, I wanted to thank you for your recent episode on healing from an unwanted cesarean. With my daughter, I had planned to have an unmedicated water birth, and instead I had an induction, Pitocin, epidural, and cesarean. After my daughter's birth, I had tremendous guilt and regret over how her delivery went. And even now, 14 months later, I still could not fully move on and let go of those feelings. The quote from Pam England that your guest read had a profound impact on me. I had carried a lot of guilt feeling that I had known better, but now I realized that I truly did do the absolute best I could have given the circumstances and who I was in that moment. Thank you for not only doing this show, but also for doing it now, as we have just found out we are pregnant with our second. I now feel much more confident in my ability to plan for and experience birth for a second time. Debbie, thank you so much for sending this email, and I'm so glad this episode helped you. If you have a topic that you want us to explore on Preggy Pals, you can either send us an email, contact us on Facebook, or also call our voicemail, which is 619-866-4775. So that wraps up our show for today. We appreciate you listening to Preggy Pals. Don't forget to check out our sister show, Parent Savers, for parents with newborns, infants, and toddlers, and our show, The Boob Group, for moms who breastfeed their babies. Next week, we're talking with the March of Dimes about how to reduce premature births. This is Preggy Pals, your pregnancy your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording, so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.